Hello and welcome to season 6 of the Fat Doctor podcast. Episode, I'm going to say episode 20. Does that sound right? I think so. Episode 20. Um, yeah, I'm recording this just a couple of days after releasing my book, No Way, Everything You've Been Told About Weight Loss is a Lie. And so I'm feeling rather excited and a little bit smug, if I'm honest, about the whole thing. The one thing I kind of recognize about this book is it does a really good job of explaining all the things that are wrong with the way that doctors treat their fat patients. Um, and so you might get to the end of the book and just go, oh, fuck. Now what? So I thought I would spend the next few episodes of this podcast really trying to speak to people, to fat patients, really, to fat people in general. And even if you're not a fat person, you probably know fat people who will benefit from this, or you're an ally or a healthcare professional who's trying to do better by your fat patients. In which case, great, this is for you as well. But I really wanted to focus on the experience of going to see the doctor and what can you do in the here and now. Yeah, sure. In an ideal world, the system changes, the world changes, the world becomes a kinder and more respectful place for fat people, especially within the healthcare profession, in an ideal world. And I do believe that's going to happen. I do believe things are changing. I think there are people out there that actually are genuinely interested in making a change, and that gets me very excited. But what do you do in the meantime? Because right now, you can't wait for things to change. So I have created a few, what do I describe them as, kind of composite characters. They're not real people because I don't like sharing real people's information on the podcast, even if they give me permission. I don't like it. It's uncomfortable, doesn't feel right, doesn't sit right with me. So I am creating people characters based on my own kind of experience with my own patients, but also the hundreds and hundreds of you who have over the last few years told me your stories, been so generous as to share your stories and told me what it's really like, what you're really struggling with. So you might see some of yourself in these characters. That's not intentional. I'm not speaking about you personally, but there's a reason you'll see yourself in some of these characters is because this is really common stuff. This happens to most fat people. You are not alone, is what I'm trying to say. So today we're going to talk about Ren. I don't think I've used the name Ren before, and if I have, it's too late now. I keep doing web searches for names that aren't just the typical names that we always use. So Ren, meet Ren. Ren is in their early 40s, as my characters often are, because a lot of you are. Ren works from home in something techie, I think, something analytical, because they're an analytical person. I'm not saying they're autistic, but I'm not saying they're not autistic either. They live alone, and they are quietly competent. That's what I've written down. Just one of these people that just seems to know a lot about things. The kind of person who researches everything thoroughly before making any decision. The kind of person that has a lot of knowledge because they've acquired that knowledge over time. And that includes knowledge about their own body and about medicine, even though they're not medical. Ren's been managing a persistently but intermittently sore throat. Comes and goes, but it's always there. It's been there for years, actually. Occasionally develops a hoarse voice, especially when talking, on Zoom meetings and stuff like that. Can develop a hoarse voice. Sometimes it's just random, and it's there for a few days, and then it goes away. And it's never been bad enough to warrant going to see a doctor about it. Although deep down, I think Ren knows this isn't right. I probably should see someone about it. They're just kind of avoiding it, as we often do. Just, pretend it's not there. Bury our heads in the sand and hope for the best. This is really, really common, I think, for everybody, really, who has medical symptoms, because you're afraid of what it might mean, and so you pretend it's not there. But it is especially true if you're a fat person. Why? This is why. Because the last time Ren went to see a doctor, went to see a GP, the GP spent the first 10 minutes talking about their weight before Ren even got a chance to talk about why they were really there. Because actually, they were there for a rash. Granted, it was a rash and a part of their body that was, slightly chubbier, slightly fuller, slightly more voluptuous than some people. But still, it was just a rash. It's just a rash. And they went to the GP, and the GP went, "Oh, I'm going to talk to you about weight loss." Turns out the rash was contact dermatitis, and it hadn't responded to over-the-counter medications and it needed a stronger steroid. That was all, but it resulted in a 10-minute long weight loss lecture. And at that point in time, there's the whole like one appointment, one problem per appointment thing that doctors have drilled into their heads of all their good, compliant patients. And also, like, at that point in time, women just wanted to get out there. I couldn't even think about talking about their sore throat. So they left it. Oh, maybe I'll talk about it another time. And that's the end of that. That was ages ago, like 18 months ago. They don't want to go back to see their GP. Totally understandable. And by the way, Ren is not the kind of person who avoids things in general, right? They're just somebody who has learned that this particular thing costs too much. This particular thing isn't worth it. So what do? They Google their symptoms and they ask around and they, go on Reddit and Facebook or whatever. And they've convinced themselves that it's probably nothing to worry about, even though they know deep down inside it might be. They've convinced themselves they're okay. And they have a sort of a well-worn set of coping strategies, like herbal teas, honey and lemon. They take supplements, and they try not to get too involved in wellness content because they know that there's a very fine line between helpful content and really problematic, sort of far right, hideous content. It's a blurred line, but they are trying to do whatever they can at home to manage this sore throat that comes and goes. Anything that feels like they're doing something, because otherwise they're going to have to walk into that GP office again, and they don't want to do that. And so, listen, avoidance is completely rational. This is not irrational behavior. Like I hear some doctors say, well, it's not my fault. If the patient doesn't present with a symptom, how do I know? How can I treat them? That is really, that's blaming the victim, isn't it? That's shifting the responsibility. No, avoiding the medical profession because you experience so much stigma and so much trauma is a completely rational response. It's not a personal moral failing. It's a rational response. There's nothing wrong with Ren. There's something wrong with the system. I'm not even going to blame the individual doctors. I'm going to blame the entire system. Ren's just doing whatever they need to do to survive. Now, the turning point comes one day when they got a friend, they're having a chat with a friend, and a friend mentions that their boss was recently diagnosed with a form of lung cancer. And that lung cancer had been pressing on the laryngeal nerve that controls the vocal cords. I'm getting a bit technical here. I doubt that's not exactly how the conversation went, but that's basically what was happening. And as a result, the boss had a very hoarse voice that didn't seem to settle for several weeks. And then they went to the doctor, and the doctor did some tests, and they did an X-ray, and then they found this tumor. And now, poor chap's got lung cancer, and it's terrible, and having to have chemo and surgery and blah 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 blah. And of course, Ren shits the bed. Oh shit. I have a sore throat. I have a hoarse voice. What if it's cancer? And then there's that terrifying moment, isn't it? Because Ren knows now I can't ignore it anymore. And they probably knew this whole entire time, but shit just got real because now it's someone he knows or doesn't know them, but knows off. It's no longer something that they can ignore. And don't worry, folks. Don't worry. Ren doesn't have lung cancer. All right. If I were to diagnose Ren, I understand that this is a made up character. Okay, it's not real. Now I'm diagnosing fictional characters like I'm in an episode of House because I don't have real patients anymore. And it's the one thing I miss more than anything is the diagnostics. That's I love a puzzle. So if I had to guess, Ren almost certainly has reflux. And the reflux is causing this change in their voice. It might cause a cough as well. Reflux is very, very common. Always gets blamed on weight. Actually has nothing to do with weight. Has to do with the sphincter at the top of the stomach. not doing its job properly. And it's supposed to close when you're not eating and only open when you're eating. But if it doesn't do that and it opens when it shouldn't, then acid from the stomach can reflux out and go all the way up the food pipe, the esophagus, and it can get into the throat. And that can cause a cough, especially at night when you're lying down and it's worse. It can also cause sore throat and intermittent hoarseness. So there you are. I've just diagnosed my fake patient. It's really easy to treat. And if Ren had not experienced all of that awful weight stigma every time they saw their GP and wasn't avoiding the GP, probably, I reckon most GPs would have come to that conclusion pretty easily. Could have tried, let's try on omeprazole, lansoprazole for a month, see if it makes it any better. It's pretty standard stuff. There's nothing too weird about this case. It's just that Ren didn't feel comfortable talking about it and never got the opportunity to talk about it. And that's the real cost of staying away, isn't it? Yeah, I can tell you some horrendous stories of diagnoses that got missed, and you just think, oh my God, how could that happen? And there are people dying, literally dying because of it. And they are really, really tragic. And I don't want to diminish those stories at all. I don't want to, I don't want to take away from the power of those stories. And also, I want to point out that for most people, it's the little things, putting up with the sore throat and the hoarseness and all that stuff for years on end because you just don't want to go and see the doctor. It's all the little things that are adding up. It's like a bit like microaggressions, Like there's the explicit prejudice and discrimination, the fuck faces that are marching in the street right now and make England great again and all this shit that's going on around. That's very explicit and that's really horrible. But it's the little microaggressions that get to most people, the tiny little things that add up. They're not that tiny actually, but it's the quieter things, the less obvious things that add up. And I can't stress this enough. That's just as important. There's the don't miss the lung cancer part, of course, but there's also you missed it's not you miss. You didn't get a chance to treat the reflux. That's just as important. And I talk about the consequence of medical weight stigma in chapter 4 of my book, No Way. It's an entire chapter. I personally think it's the most powerful chapter. I guess it's because I'm the doctor who's been on the wrong side of the table and has caused so much harm over time. I think that's why I'm, I find it really important. But yeah, I basically make the point that doctors are the ones that are making their patients sick because of weight stigma. This is the reason. And if you think about it logically, if people are staying away and they're not getting the care that they need, not only are the important diagnoses getting delayed or missed altogether, not only are the little things that add up, causing distress over time, but we're not picking up the things that we should be picking up, that we would be picking up in thin people, like high blood pressure. We know that if we don't treat high blood pressure, people are more likely to have a heart attack later on. Fat people are more likely to have heart attacks. Like, we know this. Well, who's to say it's not because of weight stigma? In fact, there's a strong argument to be made that it is because of weight stigma. A combination of medical avoidance, of missed symptoms, of not treating the root cause and just fobbing people off with lifestyle and weight loss advice instead. And the stress of not getting adequate healthcare. You put all of that together, it's no wonder fat people are more likely to have heart disease. But who's responsible? We cannot accept a healthcare system that is designed to punish fat people, because fat people will stop coming to us. And we know this. There are certain things that, there are certain groups of people that we know are not going to report symptoms unless we facilitate or create an environment where they feel safe enough to report them. It's why sexual health clinics will have special kind of clinics that are specifically for young people, because young people might not want to go into a regular clinic, but if it's a specific clinic for young people, maybe they'll attend. That's why they have clinics for the LGBTQ community. That's why we are trying to encourage men to report mental health problems. That's why there are times when the medical profession is finally cottoning on to the fact that, maybe we ought to be doing this better. And so we do. But when it comes to fat people, it's like, who gives a shit, right? Nobody, nobody cares. Um, Conditions are caught late, symptoms are normalized, and fat people avoid seeing the doctor. And weight stigma is the root cause of all of these things. Not laziness, it's not even neglect, is weight stigma. So yeah, chapter 4 of the book talks about like, what fat patients have come to expect from going to see their doctor. I don't need to. If you're fat, you know what I'm talking about before I even say it. First of all, there's the look. You know the look. You've experienced the look as you're walking in. It's the look they give you as you're walking in, as you sit down. It's the way that you can tell that they have already entered onto the computer, weight related joint pain or weight related fatigue. It's like they've already decided. That's what it is. It's like the diagnosis has already been made. Decision made. That's it. I know what I'm doing. Before you even have a chance to sort of explain what's going on. It's the way that they push you, like it's like they've got an agenda. The doctor is convinced this is weight related, and so all the questions that they ask, they kind of steer you in the direction of weight. It's like they're not willing to consider other options. And often, more often than not, the moment they get an opportunity, they'll jump in and they'll start talking to you about weight, and you're like, just give me a chance, man. I mean, I just sat down, and that's really bad practice, by the way, because if there's one thing that doctors have learned is that we're supposed to start with very open questions, and we're supposed to shut up and listen, actively listen, before we start dispensing advice. The dispensing advice part is supposed to come at the end of the consultation, but doctors are really quick to jump in there, and derail the consult by going into weight loss territory. This is especially true now in the GLP-1 society that we live in. It's like pre-GLP-1 and post-GLP-1. I was going to say pre-G and post-G. Is that good? Yeah. But nowadays with GLP-1, it's like the sales pitch is just at the tip of every doctor's tongue. Like the moment they get to, oh, have you considered GLP-1s? Have you thought about Ozempic? Have you thought, because they're desperate to sell it to you. And there's a reason why, and that's in chapter 8 of the book. But let's just admit for the moment that that is the reality for most people. And that's why Ren dreads making this appointment. And this is why Ren's been putting it off. And as I said, it makes complete sense. The system is working exactly as it was designed to work, to pressure and coerce people into losing weight. The system is designed this way so that the weight loss industry, pharmaceutical companies and weight loss companies can make good money through doctors without doctors having to do any work. Like they don't have to do any of the heavy lifting. Just a few comments here or there, a couple of derailed conversations, and the weight loss industry is cha-ching, all of a sudden selling, another GLP-1 sold. I just got to turn my phone on silent, folks. I always do this. So the system is working exactly as it's supposed to. And you might be wondering, well, Asha, this sucks once again. You're telling me how shit it is. What am I supposed to do about it? Good question. That's what I'm going to spend the rest of the episode talking about. I was having this conversation with my therapist the other day, and I said something that I thought was quite profound. I said, I often feel powerless. And I recognize that it's because I give my power away. It's not because I am powerless. It's because I allow other people to have too much power over me. And I have daddy issues. This is all very obvious why it exists, and I don't want to get into it. But I said I've spent a lot of my life trying to create situations in which I feel more powerful. And I suspect going to medical school and becoming a doctor was one of them, right? Because who has more power than a doctor? Very few professions in the world with that much power. But the irony is I never felt like I had any power in the consultation. My therapist was like, what? I was like, I know. It's not to say I didn't. Logically, objectively, I had all the power. Subjectively, I had none of the power. And this is why, because every single patient, as far as I was concerned, was the person that had the potential to destroy my medical career. And now I know I'm not asking you to feel sorry for me. I don't need you to get your little violin out. I'm just saying that in my mind, I was actually very afraid of the patient because I knew that if I fucked up or if I upset them, they had the power to complain, to initiate an investigation into my practice, and that could cause a lot of problems for me. Up to and including having me struck off the medical register. Now, this was a very irrational fear. It's actually very difficult to get a doctor struck off the medical register. The haters out there are all spreading a rumor about the fact that I've been struck off, which is hilarious because I haven't. But that's neither here nor there. It's actually quite hard. Like, you really have to seriously fuck up to get struck off. But I want you to understand the reason I'm telling you this is not because I want you to feel sorry for me. The reason I'm telling you this is that you actually do have more power than you think you have. As a patient, I imagine you sitting in front of the doctor thinking, you have all the power and I have none of the power. And that is, I think, objectively is more true, you know. And also, as a doctor, I can tell you, I don't want to mess up. And B, I don't want you to complain about me. In the UK, the complaints procedure is no fun. As a doctor, every time a complaint is made against a GP, not only do they have to answer the complaint, but they also have to talk about the complaint during their appraisal process, which is part of revalidation. So every year, you have to fill in this document and you have to talk about every single complaint that was made against you. So if you've got like 10 complaints, you've got to talk about all 10 of them. And it's, if nothing else, it's rather humiliating. I'm not saying don't make a complaint. I mean, I'm saying you should make a complaint. I'm saying that if you knew how much power you actually had, then that might make life easier for you. It might not, but it might make life easier for you. One of the ways to feel empowered is to understand your rights, what to expect from your doctor, what they should be doing. Because then if they're not doing it, you can say, hey, you're not doing your job. Worst case scenario, I'm going to write a complaint against you. And you don't usually have to take it that far, but I wanted to sort of bring this up. I'm not sure if I'm bringing it up the right way, but I really wanted to let you know that you actually have more power than you think you have. And the power comes from the knowledge, not the knowledge about your symptoms or your medical condition, by the way. That is one thing I really want to talk about, and I'm sure I will talk about over the next few weeks. You shouldn't have to research your symptoms and your medical condition in order to get the care you deserve. Like, that's bullshit. Your doctor's literally getting paid to do that. I understand why you end up doing it. I understand why sometimes it becomes necessary, but I'm talking about knowledge about what you are entitled to. Know your rights. Isn't that always the case? Isn't that why society is so afraid of unions? Society is so afraid of like educators, libraries, books. Because once people know what they're entitled to, they can no longer be fobbed off by lazy, incompetent, fat-phobic doctors. So knowing what you're entitled to, knowing what should happen, I think is probably the first step into how to address this problem. I talk about it a lot in the book, what you're entitled to. And I also have, for those of you who've joined the No Way movement, you're entitled to a free script. You get a free script when you join the No Way movement. That basically, like, you can take this script and you can literally bring it with you to your doctor's appointment so that you know what to say, how to open the conversation on your own terms. One thing I'll tell you is that doctors are supposed to be patient-led. We're supposed to provide individualized care. In order to provide individualized care, in other words, we don't treat it, it's not one size fits all, like specific to you. We have to know what you think, what you believe, what you want, what you're concerned about, what your expectations are. We have to understand those things. We need to get to know those things. And sometimes it's just easier to be explicit about it, just to be very much like, hey, this is why I'm here. This is what I'm expecting. And that's where the script really comes in handy. You've already got it all written down and you say it out loud and you set the agenda right at the beginning and there you go. The agenda is set, and then instead of being derailed into the GLP-1, bullshit sales pitch, you stay, hey, can we get back to my agenda, please? Because your agenda is the one that we're supposed to be following. Not ours, yours. And by ours, I mean doctors. So If you set the agenda and you're headed in one direction and your doctor is trying to derail you into the weight loss territory, you can you can be quite sort of explicit about it. I'm just going to stop you there. I really don't want to talk about weight loss today. I'm just going to stop you there. I refuse to talk about weight loss today. I'm just going to stop you there. I refuse my consent to discuss weight loss today. I don't know how you want to do it exactly, what feels right for you, but you really, a hand up in the air really does help, like a stop, the universal stop. I'm just going to stop you there. I don't want to. If you don't want to talk about weight loss, then your doctor has to stop talking about weight loss. And if he keeps bringing it up, he, she, they, apologies, if they keep bringing it up, even though you've told them, you can get more and more firm with them. Hang on, I've already said I don't want to talk about it. I refuse my consent. Use the language of consent because they really don't have the right to. And if they still insist on it, be like, look, I'm going to have to ask you to document in your notes that I have repeatedly said I don't want to talk about weight loss and you keep doing it anyway. If you live in a country where it is legal to record somebody without two-party consent, you can always record all of your conversations. You know that, right? You can just record them. If you have a telephone conversation with a doctor, chances are that's being recorded anyway. So the more you stand up for yourself, if the doctor is choosing to ignore you, again, this is a place where you have a lot of power. You can say, hang on, I said no. You did it anyway. And that's wrong. You can't do that. It's called consent, right? It's one of the many things that you are entitled to. There's a lot more, and we're going to cover more and more over the next few weeks. But like I said, it's very much laid out in chapter 4 of my book, what you are entitled to, what you can expect from your doctors. I even quote the General Medical Council's standard, good medical practice and standard for care. And like there are some very explicit sort of, I don't know, it's not commands, but basically like this is what these are the expectations. This is what you are expected to do. This is your duty of care. This is the standard you're being held to. And if you're not doing it as a doctor, then you are in breach of your duty of care. And that's a big problem. Because, like I said, appraisal every year, revalidation once every 5 years. You can't revalidate if you are in breach of your duty of care. And that's a serious problem that should be addressed. So know that you have power. Not necessarily, I don't want you to go around trying to ruin your doctor's medical careers and get them struck off the medical register. It's probably not the healthiest attitude to have. Although, there are moments when I meet some doctors and I'm just like, you really are pushing all of my buttons. You don't want me to push back. But in general, I think, there is a sort of slightly more balanced approach here, which is to say, hey, I have some power here. I have rights. I am entitled to certain things. And if you're not doing it, that's a you problem and not a me problem. And I'm going to do whatever it takes to get you to do it. It helps to have community. It really does. It helps to have community. My community is called the Waiting Room. It's a community I've designed specifically for neurodivergent people, but of course everyone is welcome. And there frequently people will just be like, oh, I'm going to go and see my doctor, or I've got an appointment here, or I've got this, or wish me luck type of thing. And just knowing that there's solidarity, that there are people in your corner, people you can vent to, people who can support you, people who can, advise you if that's what you want. Having community is so important. It really does help to have community by your side. It also helps to have an advocate with you in the moment. I'm a big believer of bringing an advocate with you to every appointment if you're a fat person. It helps to recognize what is going on around you, like the systems, the reason, for example, why doctors are so hell-bent on prescribing GLP-1s. Again, education, knowledge is power. So knowing this stuff helps. It helps to understand what's also happening to you in your body. That actually in high stress situations like a doctor's appointment, chances are you're going to go into fawn mode even if you don't want to. Fawning is a survival technique, and most of the time we'll fawn, then we'll get out of the appointment and then we'll think, fuck, why did I do that? Yeah, it's normal. Also to go into flight mode, we very rarely go into fight mode when we're around doctors because antelopes very rarely try to fight cheetahs or lions or whoever's trying to attack them. Fight mode is kind of, you got to know that you've got a chance of winning, and we don't feel that way. So fight is unlikely, but flight is very, very common. So it's common to feel like, I just need to get out of here. I need to get out of here. Like you're looking to the exit and you'll do whatever it takes to get out. Even if it means agreeing to something you didn't want to agree to, even if it means that you know, forget half the things you want to say, even if it means you just like, even if you've got a list in front of you, right, and you've got 10 things you want to ask, and you're just like, fuck it, you just go because you're in flight mode. Yeah, helps to know that. Also helps to know that if, you know, fawn flight, the other one is freeze, and freeze is very, very common as well. So knowing what's happening in your body, understanding, you know, the physical symptoms, the way that you respond, and it differs from person to person. It's all about, you know, your own personal and lived experience and how that affects how you react in these situations. But understanding it, you know, understanding the hypervigilance, understanding the fact that often you'll be quite defensive in this situation, and that's okay. Understanding your communication style and stuff like that. Like it's important to understand it and sometimes to name it explicitly. Listen, I've had some really bad experiences with doctors. I'm actually really stressed out right now. I'm actually really fearful right now. I and you know, these things, you know, I'm really worried that you're going to dismiss me just because of my weight. Being very explicit and naming these things can actually be really helpful. So that's another thing that you can do. But that being said, all this advice, and really, you know, I want to speak to all the Wrens out there in the world right now. You know, if you've got a symptom and you've been avoiding the doctor because you don't want to handle the weight stigma. I get it. I totally do. But also I want you to go and see your doctor. I don't want you to hold these things. I don't want you to, even if it's not anything serious, even if it isn't cancer, it's probably not cancer, by the way. No matter what Google says, it's probably not cancer. But but I still want you to go and see your doctor. If nothing else, because you shouldn't have to suffer in silence. And I then want to remind you that it doesn't have to be perfect. It just has to happen. And it might be a really unpleasant experience, or it might actually be go much better than you expected. You don't know. But sometimes, you know, we're like so desperate, like, oh, I'll go once I've done the research. I'll go once I've figured out what's wrong. I'll go once I've read this thing. I'll go once I've lost the weight. I'll go. Don't do that. Just go. Just get it done. Make the appointment. Tell someone you're making the appointment so they can hold you accountable. Get someone to make the appointment for you if you can't make it yourself. Whatever it takes, get there. It's that's the most important thing. You don't have to be perfect. You don't have to be great. You don't have to be any of those things. You just have to show up. As I said, there is a script. So if you need a script, if you're already a member of No Way and you're like, oh, I wish I had the script, like yeah, there's a script. Very easy for you to come, just email me, I'll send you the script. If you join the No Way movement, you'll automatically get it. And I think the script can be very helpful. And I personally, as a doctor, if someone came in with the script and literally read from it, literally was just like, this is why I've come to see you today, and literally like laid it out in 30 seconds, I would be eternally grateful, if I'm honest, because it just made my life a whole lot easier. I know why you're here. You've done a little summary of things. You've said all the things I need to know. You haven't said the things I don't need to know because it's one of the things. It's like, let's not overwhelm the conversation. And you don't know what bits are important, which bits aren't important. So the script kind of helps with that. And yeah, it's all laid out. Cards are on the table. Everything's very clear. Everything's very explicit. And there is a little bit in there, some language around like not wanting to talk about weight, not wanting to talk about weight loss, not wanting to talk about Ozempic, not wanting to talk about bariatric surgery. Like, you know, you can be very explicit about that. That's not what we're here to talk about today. So yeah, if you haven't got it already, I suggest you get the script. If you haven't ordered the book already, get the book. If you want to know what the hell I'm talking about, check out noway.org/start here. Because start hyphen here because it's a really it's a very good place to start. And I will see you back here next week when I introduce you to a new character who has a different problem and who I'm going to attempt to help. I'm not sure if I help this one, so we shall have to see. Thank you very much for being here, and yeah, I'm just going to sign off. Take care.